Okay, well, welcome everyone. Thank you for coming today. I'd also like to thank our elected officials who are here from many municipalities throughout Spokane County. Thank you very much. I'm Kelly Hawkins. I am the Chief Information Officer here at Spokane Regional Health District. I also have here today Amelia Clark. She is our Administrative Officer, our fearless leader. And we have Lyndia Wilson. She is our Director of Community Health, and she's also the Incident Commander for our COVID-19 response. Her team of emergency response and preparedness professionals, including our epidemiologists, have been following the COVID-19 virus for weeks now. And they've been working tirelessly, I can tell you myself, through weekends with community and health partners over the past several weeks to ensure the health and public safety of our community. So those of you out here, thank you very much. I'd now also like to introduce Dr. Bob Lutz. He is the health officer for Spokane County, and he's going to talk to you about our current status and guidance in regards to COVID-19 here in Spokane County.
Good morning, all. Thank you, Kelly. Thank you, Amelia. Thank you, Lyndia. Thank you, epidemiology staff. And thank you, elected officials. In the Northwest, we're certainly all too familiar with disruptions caused by our changing natural environment, ice storm, windstorm, and most recently, wildfires. That said, we've not found ourselves having to concern ourselves with a public health pandemic in our lifetimes. I'm here with you this morning to provide an update on the preparedness activities and recommendations as we prepare for the COVID-19 pandemic's impact in our community. Early in an outbreak situation, efforts are directed at what we call containment. This involves identification of cases, isolating them, and quarantining others who they've come in contact with. The focus being to prevent the spread of infection. While locally we remain in somewhat containment mode, our efforts are rapidly moving to mitigation. This is to slow the spread of the virus we believe, really know, is already here, although we do not as of yet have documentation. Mitigating strategies are important so we can first support the healthcare system and our emergency responders. Provide time for research and providers to better understand this virus to be able to better care for those needing it in our hospitals. Better characterize the infection to best guide public health recommendations and develop medical countermeasures, such as improved diagnostics, medications, and treatments, to possibly include vaccinations for prevention. An implementation of what are called NPIs, non-pharmaceutical interventions. Examples include social distancing, limit the number of sick individuals at a point in time to ensure optimal health care can be provided to both them as well as others throughout the community. Allowing businesses and organizations time to develop and/or institute continuing operational plans to minimize the inevitable disruptions that will occur, and assist you, the public, to prepare for the changes in your daily routines. I'd like you to look at the graph that we have up behind our elected officials. Everybody duck? No, just those in the middle. So what I want to point out is this is called an epidemiological curve, and there are two curves that I really want to emphasize. The first is if we do nothing. The large, purple, solid-colored curve is if we do not do any interventions whatsoever. And you have a very, very rapid acceleration of cases, as we are seeing both internationally and nationally, and locally. So as of yesterday, we had in Washington State about 100 new cases overnight, and today a similar number. I then call your attention to the shorter curve, the lower curve, the hashed one. That's our effort. What we want to do is both slow the onset of illness and slow the impact and lessen the impact. And that's what these mitigating efforts do. If you note the arrow, that's where we are right now. We're sort of on the slope, on that very starting part of the slope. What we don't want to be is farther up on that slope, because then the efforts become so much greater. And again, it's been compared to somewhat like a flood. So you know that if you have heavy rains all at once, the system will be quickly overwhelmed, and you may not be able to recover. If, however, you have the same amount of rain that slowly falls over a period of time, then the system can adapt. We have to be able to adapt. And if we don't provide that kind of backing for our healthcare entities, then they will be quickly overwhelmed, as we are seeing both on the West Side and internationally. So acknowledging that we are still ahead of the pandemic in our community, and knowing that by increasing prepared actions now, we can slow the progression of COVID-19 so that the bell curve looks, as I said, at the lower, shorter curve rather than the steep purple curve. The community actions most useful for attaining that shorter bell curve is social distancing. That includes in schools, workplaces, events, meetings, and places where people gather. By increasing distances to at least 6 feet between people when possible, you reduce the person-to-person spread of this infection. Social distancing can also be accomplished by postponing indefinitely or canceling large gatherings and events. And here's what I recommend starting today, but formally going into effect at 5 p.m. tonight, based upon the statutory responsibilities that are granted to me. During this critical public health situation. The canceling of large community events and gatherings in excess of 250 people for at least 30 days. This includes sporting events, concerts, festivals, conferences, places of worship, and other settings where people gather. Additionally, we recommend canceling any gatherings where indoor social distancing is not possible, regional events where attendees come from multiple locations, including those outside of this area, and where vulnerable populations would be the majority of attendees. Similarly for schools, we are not, and I emphasize we are not, recommending the closing of schools at this time. But we are recommending, starting today at 5 p.m. again, the canceling or postponement of large gatherings such as assemblies, performances, and sporting events, and other activities that bring young people into situations where they are in close contact, such as field trips, club activities, again for the next 30 days. As the weather improves, which hopefully is any day now, maybe moving activities outdoors as permitted will support the continuation of the school day while also supporting social distancing. Consistent with Governor Inslee's guidance yesterday, we advised schools to enhance social distancing of students from one another as much as possible. Schools should also be looking at how to modify how they provide meals to their students, remembering that for many in our community, schools serve as their primary source of nutrition. And superintendents and administrators should consider providing no-cost childcare to families and to support students experiencing homelessness. Also, schools should incorporate regular hand washing into daily activities, encouraging students and staff to cough and sneeze into a tissue or their sleeve, communicate with parents the importance of keeping their children home if they are sick, especially if they have similar symptoms to COVID-19. And of course, encourage staff and faculty to stay home if they are sick as well. This is an evolving situation. We will discuss daily what further actions need to be taken as the virus progresses in our community. For individuals, continuing to follow the guidance we have shared through the media and is available on SRHD.org. That includes staying home when you are sick, using good respiratory etiquette and hand hygiene, washing hands often and thoroughly with soap and water, avoid touching your eyes, nose, and mouth, practicing other good health habits, having a plan for those with students of school closures in the event of school closures, and again, preparing yourself and family members for the possibility of contracting COVID-19. These recommendations will change as the situation with COVID-19 becomes more prevalent in our community. We're working daily, literally hourly, with community partners to assess Spokane County's status with the COVID-19 pandemic. We will monitor conditions and update guidance accordingly. Importantly, we will continue to provide you regular information and guidance on this evolving situation. In conclusion, these recommendations are being made to prepare all of us for the unfortunate but necessary disruptions in our daily lives, as the bell curve demonstrates, to help our community endure the COVID-19 pandemic with as little impact on our community's health and well-being as possible. Public health usually serves as the community's unseen and unrecognized safety net. In situations such as this, however, public health is out in front, ensuring the health of our entire community, especially its most vulnerable members who often suffer the most. Specific guidance for various sectors can be found at our website, or if you have specific questions, please call 1-800-525-0127 and press pound or hashtag. Thank you. Any questions? Yes.
Can you give an update on the 2 patients that were transported to Sacred Heart a couple weeks back? Are they still in the hospital? That were a part of those 4 total?
I looked to my PIO, who's more on top of this than I, potentially. The question about the Providence.
Oh, the Providence patients?
I apologize, I've been a little distracted.
I did hear that there was an update from Sacred Heart that 1 patient was released to go home. They had the double negative results, and 1 patient resides at the hospital, and they are in satisfactory condition.
So of those 4, there's just 1 left now?
1, yes.
And so we still have no cases in Spokane County?
As of this time, and I look at my epidemiologist, that is true. What I will say, however, is that we are getting case reports on a regular basis, and again, I think it's just a matter of time.
And do we know how many people have been tested, or how many you guys have sent out?
We really don't. I mean, early on in the investigation, when we were more in containment and we were sort of responding to everyone, we had a sense. Now, since the opportunities for providers to get testing done is at their discretion, we really do not have a sense as to how many tests have been done, but we do get to see the reports when they come back, and there's a lag time between when they're tested and when they come back. Yes?
Could you speak to our healthcare system's preparedness, what they are doing? I don't know if there's coordination with all the folks standing up here to support our healthcare system, and also speak to what the public can do to not overwhelm the healthcare system.
Yeah. I am sincerely impressed by the coordination of efforts by our healthcare organizations, acknowledging that they are competitors, but also collectively identifying that they need to collaborate to address this community-wide issue. So over the last couple of days, for example, there have been daily or almost every other day meetings in looking at how to best address and looking at things such as resources and testing capabilities. So again, I think that the collaboration is good. Unfortunately, the lessons learned from the West Side are dictating some of those best practices now. Many of their partner organizations on the West Side have found themselves overwhelmed and at times actually having to look at making critical decisions, such as who gets ICU beds. And that's, again, what we don't want to have happen here. So again, I referenced that bell curve. By being as proactive as possible before we start on that upslope, the evidence demonstrates that that will prevent the onslaught of infection here and therefore having the healthcare systems overwhelmed. Yes, sir.
Can you speak to what factors might change your recommendation regarding schools?
The question is specifically around school closures. This is a conversation that I think is imperative for us to understand at multiple levels. By far and away, it is probably the one decision which will impact the most number of individuals across our community, both young people as well as adults and the businesses. You know, we already know that it's, for example, very challenging for people to find childcare. So if all of a sudden parents are having to stay home to care for their children, what do you do when they can't go to work? So again, the ramifications are significant. This is a conversation that I think is essential that we as the health district, that we as partners deal and work with the school districts. For me, the fact that as of yet, I have no local cases, as of yet, I know to the best of the science that we have that this has not been an infection which is predominantly affecting young people. And the reality is that it's affecting older individuals much more significantly. Those are factors that I think need to be weighed in. You know, the studies right now have shown that unfortunately, if I close schools for a short period of time, it does very little in addressing that epidemiological curve that I mentioned to you before. I have much more benefit if I am, again, working with social distancing and closing events with large numbers of adults. So at this time, my recommendation stands, but again, as I mentioned earlier, it's an evolving situation. and we will be keeping you informed as well as working closely with superintendents before any of those decisions are finalized. Yes, ma'am.
Can you speak to the number of testing sites or tests that are available in our community based on, the amount of people in our community?
Sure. And again, the question is around the availability of testing. This is a challenging issue, at both a national level and locally. Although the testing criteria have been liberalized, that does not necessarily mean that testing kits are available. And I think there's a bit of a misunderstanding. People are used to going to their doctor and being tested for a sore throat with a simple swab that they then get results back in 5 minutes. This is not the case. So although your providers, the emergency rooms, urgent cares, may be able to test for the virus, it requires the test and the actual swabs to be sent off to laboratories. In the state, we have two. We have the Public Health Lab at Shoreline, and we have the University of Washington. Nationally, there are other organizations such as Quest and LabCorp, both of which came online last week, both of which, however, at the national level have a very limited capacity. So when I was driving yesterday, I heard that both say that they can probably do up to 1,000 tests per day for the entire country. Okay? So that is, in my opinion, a very limited amount of testing capability, and it's no different in our state. So it's really difficult for us to know, as I said, that I do not have it here because I haven't had sufficient testing to demonstrate that it's here.
Dr. Lutz, how did you come to the 30 days? What is the purpose of that length of time and not going longer or shorter than that?
I think primarily because it's a continuing, it's evolving situation. Certainly evidence from other communities suggests that 30 days is going to be insufficient, but I don't know that for a fact. You look, for example, at the international experience in South Korea, where they've been able to, again, keep themselves on that shorter bell curve by being very aggressive at both social distancing, mass events, and screening and testing. So my hope is that by, again, giving that 30-day period of time gives us sufficient time to, again, mobilize the healthcare system, mobilize partners, but again, it's 30 days. And I may be back here in 29 days saying I have to extend it.
And to follow up with that, what factors will you and partners be looking at to decide whether or not to extend that 30 days?
A lot of it is going to be based upon the conditions in the field. So if I'm seeing an uptick in number of cases, so again, I look at the fact that at a state level, we had more than 100 cases come through yesterday, and more than 100 come through today. Okay, for me, that's significant. If I start seeing an uptick in our community outbreak, I would give a consideration to extending. I think also, as I mentioned earlier with that bell curve, I need to be looking at the impact on the healthcare system first and foremost. It has to be strong and flexible. And if it's overwhelmed, then it's not going to be able to not only care for those individuals affected by COVID-19, but those individuals who routinely fall upon it for their care. And so for me, if I hear that the healthcare system is being overwhelmed, then the orders are going to be extended and they may become a little bit more stringent. Yes, sir?
And obviously closing schools is a tough decision, but there's usually more than 250 kids in a school at once. So what would kind of have to change for schools to be closed? And then get the plans ready.
Yeah, again, so the question is around whether I would consider school closures. If I start seeing outbreaks, if I start seeing clusters in schools, that's going to raise my concern pretty significantly. As I've mentioned to you before, to date, we have not seen significant numbers of young people being impacted by this. But we don't know. As of yesterday, I understood that actually across the state, we had a couple of people under the age of 18 who did test positive. So for me, that's of concern. Again, a lot about this virus is novel. We don't know. So it's an evolving situation, but again, it's not made in a vacuum. The decision is not made lightly. If I start seeing more cases in kids, if I start seeing clusters, if I start seeing maybe some regional types of issues, so for maybe it's only in one community, then those are reasons why I would again push for school closure. You're doing really well with all these, because you're right up front.
Could you talk about the kind of diameters of the testing itself, how it's kind of done? I heard it could be kind of aggressive when you're testing those patients.
Yeah, so the question is around the type of testing. So we do two types of testing. One is called a nasopharyngeal swab. And so imagine, if you will, that I take a Q-tip and place it in your left nostril and tickle the back of your pharynx with it. That can be somewhat aggressive, but that's how I get specimen. The other is like what you would do at your clinic where you would get, again, tested for sore throat. I take a similar or the same type of Q-tip, and I swab the back of your throat. So both of those have been found to be useful, and maybe one more so than the other, as the means by which we actually can find the virus.
Is the health district or any other jurisdictions taking specific measures to add sanitation facilities, anything like that, for the homeless population, any additional outreach or hygiene education efforts?
Yeah, so the question is around extra outreach to the homeless population. Again, we've been very proactive, as you know, if you've been following our efforts around the homeless population over the last couple of months, for example, with hepatitis A. You know, it's an outbreak that's still ongoing. You know, the fact that I still have 80 plus individuals who have been diagnosed with hepatitis A across our community, the majority of which have been homeless, again, for me, is not something that I can take lightly. And so we've been working very, very closely with our providers over the last couple of months. This has actually ramped up our work with them because it's a different type of virus, it's a different type of infection. The hygiene criteria are somewhat different. So we've had regular meetings with the homeless providers, service providers. We've made site visits to the different shelters providing recommendations. So for us, that is one of those at-risk populations just because in their current status of being highly sheltered, they're in very close proximity, which sort of goes counter to social distancing.
Dr. Lutz, I've had a lot of readers call me pretty frustrated because they can't get tested. Can you speak to a little bit of advice for people that are experiencing symptoms but have been told by their provider that they can't be tested? And again, back to not overwhelming healthcare systems on that.
Yeah, so the question is, again, once again, about that eternal question of how do we increase testing? And again, it really is a provider discretion, and I think providers are using the discretion at some level because they, A, know that the delay in testing results is significant, and B, they know that access to actual testing at different labs is challenging. So I think it's this fine line that we run between having sufficient testing capabilities and overwhelming the system. So my recommendation to individuals is if you meet the criteria for having COVID-19, and those symptoms that we're seeing are, again, fever, persistent fever of over 100.4 degrees, cough, and or chest tightness, shortness of breath. Those are symptoms that, again, definitely warrant consideration. If those are in conjunction with you having other medical problems, such as breathing problems, heart problems, then that really warrants being tested. And if you find that for whatever reason you're still getting pushback from your provider, find an advocate and really advocate for testing. Because again, for me, I need to understand the nature and the severity of the infection in our community. And I think people also need to understand that as well.
So we
Yes.
talked with one woman who called us today, said her husband had flu-like symptoms, got tested, those came back as negative. So when they asked to be tested for COVID-19, their provider simply said, we don't have any tests right now. So you're talking about how we don't have any confirmed cases here in Spokane, but how do we, how can we get to that point where we can actually confirm that then, if no tests are available?
Well, again, I think it's a slight misunderstanding about no tests being available here versus actually having the test, the sample being provided here and being performed elsewhere. So there's no limitations whatsoever on having the swabs performed. The only limiting factor to date that, again, is it's sort of been discussed, and I don't know how relevant it is here, but there's concerns about actual volume of the viral medium. So these specimens, these swabs, have to be placed in the appropriate medium. And not surprisingly, because of the fact that thousands of individuals are being tested across the nation, there is comment that maybe the actual medium is running in short quantity. That said, there's absolutely nothing limiting an individual from being tested here. The limiting factor is then getting the test to a laboratory that can perform the adequate testing. So locally, we have vendors who have come online, as I mentioned, Quest and LabCorp. So if any organizations, any providers have their contracts with those laboratories, as many do, they work through their laboratories. Likewise, if they are at a A hospital such as Multicare Providence, they have their systems in place to be able to send laboratories, when appropriate, over to Public Health Lab or the University of Washington to be tested. Yes, ma'am?
How would this ban of large gatherings affect the court systems? Why do people are coming in and out of court all day long? I guess, what would that look like with your recommendation?
Well, I think, again, I'm looking at a continuous number of individuals in one place. So I have not been to court recently, but in my past experience, I don't typically see 250 people or more in one courtroom. But coming and going is a little bit different. So for me, it's actually that congregate situation that is more concerning than the amount of people going through a space over a period of time.
How about the Whitworth community members? Any update on their tests?
I look to my epidemiologist, and they both shake their heads no. I say no.
And so could you expand on why the sort of congregation of people versus people cycling through a given area is sort of more impactful? Or
Sure. So the question is around why a congregate area, mass gathering, versus just people cycling through the venue. And it's a function of how this virus is transmitted. So what the evidence has shown is that this is transmitted by what's called respiratory droplet, which is essentially the fluid that occurs, those respiratory droplets that occur when you cough or sneeze. Okay? So you have to be in close proximity to an individual who's coughing or sneezing at this point for you to be exposed to it. The other thing, however, that people are not maybe as aware of as they should be is that, what am I just doing now? What I shouldn't be doing. And then what did I do? I just put my hand that I touch my face onto this desk. And then what's going to happen? I'm going to basically allow what was ever on my face or I coughed onto my hand on this desk for someone else to come up here and put their hand on the desk and then touch their face. So we know that respiratory droplets stay fixed and stay viable the virus stays viable on surfaces for hours. And so therefore part of the, if you will, new etiquette for individuals is not only good respiratory etiquette and cough etiquette, but don't do this, and don't cough into your hand and then touch other surfaces. Conversely, or I should say similarly, cleaning frequently used surfaces is going to be essential. Yes?
I have a question for Mayor Woodward. I know there's some rumors about a declaration of emergency. Any consideration to that yet?
No announcement to make on that yet, but I can speak on, I think, on behalf of all the cities here in the county too, that we are working collaboratively on what our approach will be and how we'll address this.
So,
the same question to Commissioner French. Any status update there?
No, I think the mayor articulated, the collective response for all of the jurisdictions. We're working collaboratively together and in close communication with our health officer. So, no, it's the communities come together to try and make sure that our citizens are safe and that, hopefully the impact in the community will be as preventable as possible.
well, if no further questions, I thank you for your time. And again, as
One more question. If we're trying to avoid widespread contagion, why wait to shut stuff down? Why wait to declare a state of emergency? Why wait to close schools? Why not just get ahead of it? I mean, we're looking at that bell curve. Isn't that the point of that right now?
well, again, I'll go back to that. Where I would suggest we are right now is at that red arrow. And again, that's somewhat hypothetical, but that's where I believe we are right now. So I would say that we are getting ahead of the curve by being proactive now. So by issuing the health officer order, that pretty much is therefore saying that those mass gatherings, which have been shown in this infection to be a major cause of spreading the infection, we're getting out in front of it. Because I've said before, there is no evidence or minimal evidence that this is an infection that is spreading in young people, I think that it would be prudent to not advise closing schools at this time. But again, it's an evolving situation and new science may suggest otherwise. Yes, sir.
When you say not advise at this time, does that mean that the districts have their own discretion on whether to close or not?
If I place, so the question is around whether or not the schools can close on their own. They can certainly make that choice. Most, if not all, will look to me for guidance and recommendations. And so I know for a fact that there was a meeting this morning of superintendents when this was being discussed. And there will be further conversations between me and them to look at what my recommendations are going forward.
How will the ban be enforced in any way? Maybe a question for Sheriff Messages, but
We're not there yet.
We're not there
We
yet?
are dusting off the swine flu plan that we had in 2009. We have lived through this process before. This is nothing new for us. So right now, we are systematically putting together the plan that we had in 2009 to face that potential pandemic. We're upgrading that with the information that Dr. Lutz is giving us so we can address this new pandemic. So at this point right now, we are working together to make sure that we have all the contingency plans, and there is no need to take the next step. Now, if it comes down to forced quarantine, we will address that issue at that time. And there are policies and procedures and ways to do that.
Okay, well, I thank you for your time, and again, we will be in touch with you in the future. Thank you.